I'm Dr. Vasant Kumar, Senior Physician at Apollo Hospital, Jubilee Hills, and also at Apollo Clinic, Manikonda. Today I'm going to speak to you about diabetes, about its importance of diagnosing and treating and its incidence. As many of you may be knowing that there is a rapid increase in incidence of diabetes all over the country, especially of course in the urban areas. So what is important is that we must realize that we are seeing diabetes amongst young people at the age of 30. Actually, I see many times the parents bringing their young boys or girls who are just about 30 becoming diabetics. So it's important to control and to prevent diabetes amongst the young people. The reason, as you know, it's mostly because people are not doing exercises. They have become very sedentary. Most of the jobs are also most of the jobs are involved where they are sitting across with the computer and other things. They don't do physical exercises. And another important thing is the food that our people are consuming. We should make sure that people start eating healthy food right at the childhood level itself. You also see overweight even amongst the children. And when it happens among childhood, by the time they are 30, they are overweight and they are developing diabetes. So what is important about the diet? What is most important is avoid fast foods, junk foods, which has got a lot of fat, and avoid eating refined foods like white rice, avoid too much of sugary items, and also other fatty foods. So many people do not know that they have diabetes. Do you know that in India, almost half of the people who have diabetes, they don't really know that they have diabetes because they have never checked the blood glucose. So what is important is people after certain age, especially if they're on the overweight side or if there is a family history of diabetes, they should definitely check their blood glucose at least once in a year so that we diagnose the problem at an early age and so that we can treat the condition and control the blood glucose and see that they don't develop any complications in the future time. And especially when it happens in the people around 30 or 40, they should be more careful because they have another 30 years of active life. So we are not just only giving higher length of life, longevity, but we also want to give them good quality of life by providing good treatment and see that they lead active life. That is one. And especially those who already have diabetes, they should be careful with their diet. Generally restrict the calories, that is carbohydrates. Take less carbohydrates, and whatever carbohydrates they are eating, it should not be refined. So nowadays millets have become popular. Millets are important because they don't raise the blood glucose just as the white sugar or white rice. So take any millet, all millets are good, and take them in proper quantities, mix it with dal or vegetables. That will be a healthy diet. And of course,